Hello, I want to talk to you a bit about slip disc today. It's something that is very common, lots of people have heard of it and lots of people have suffered from it. Quite often though, people don't understand that a slip disc can relate to lots of different problems with the discs in the back. And just in case you're not aware of kind of the basic structure of the spine, of course we've got the vertebra, the bones, that stack on top of one another, but between each vertebra you've got this little disc which is much more softer and has sort of a gel fluid type thing within it, and this actually acts as cushioning so that, you know, in everyday activities when we're running, walking, jumping, it aids to cushion it and to make sure that the bones aren't kind of bumping or knocking against each other. The other interesting thing about our discs is actually they don't have their own blood supply. So we actually rely on kind of movements in the structure surrounding the spine, surrounding the discs, to provide the discs with the necessary nutrients that they require. So in terms of a slip disc, there are, as I say, lots of different things that are actually all put under that umbrella. One of the things that can happen is a thinning of the discs, and as the name suggests, actually that's where we lose a little bit of the fluid, so the disc decreases in its thickness there. This can go on further to cause a degeneration of the disc, and this is where you will start to suffer from chronic pain, whether it's low level or more severe. We can also get a bulging disc. Again, as the name suggests, it's where you've got that compression of the disc which causes part of it to bulge out a little bit. You can have a bulging disc and experience no discomfort, no pain whatsoever, and not even be aware that you have a bulging disc. It just depends on where that bulge is protruding. So if it's on a nerve, then you're going to, of course, experience some pain. Next step on from that, we can have a herniated disc. This is where some of the fluid actually, begins to leak out because of that compression that is acting upon the spine. This one generally is going to be the real painful one, the one that you just can't, move out of bed for, especially if it is acting and touching upon that nerve there. So as you can see, there's lots of different categories within a slip disc. When we look at yoga therapy to help alleviate the symptoms or to just help with a slip disc, then really all we're aiming to do is create space. All of those disc issues really are worsened with that compression, whether it's due to age or other forces, other things that are going on in your life. But so we just want to use our yoga techniques to just create space with those stretches and positions that we can apply. If you've got any questions, of course, drop me a message. Otherwise, thank you for watching and for listening.